Hi, I'm Peter Mollee and I'm a haematologist at the Princess Alexandra Hospital in Brisbane, where I lead the myeloma program as well as the Princess Alexandra Hospital amyloidosis clinic. I've been asked to talk with you today about some issues that you may face either as a patient or as the carer of someone with myeloma during this COVID pandemic. As way of background, the initial response in Australia to the COVID-19 pandemic was driven largely by information we were getting from the virus outbreak, particularly in China and then in Europe, especially Italy, where we saw the devastating effects of this virus in the community. As such, major preparations were made to try and limit the spread of the virus in Australia, and major alterations, particularly to our hospital structures, were undergone. Fortunately, it looks like these have prevented the massive surge in viral infections that we've seen in those countries, and the rate of new infections in Australia seems to be reducing. Whether a second wave of infection occurs is still something we need to be vigilant about. Now that we're a few months into the pandemic, however, the response in Australia of government, hospitals and doctors is driven much more by local epidemiology. So what do I mean by that? Epidemiology refers to the study and analysis of the distribution and patterns of disease, in this case the COVID-19 infection. It covers the who, the when and the where. For example, who gets the virus, when do they get it, how long does it take for infective symptoms to develop, how long does it take to recover, and where are infections occurring. The epidemiology of COVID-19 varies considerably throughout the world, and even in Australia we have variance between different states. Because of this, recommendations regarding community practices as well as your own healthcare in terms of management of myeloma will vary. Some will be universal and some will stay the same, but some will vary between different jurisdictions. The constant ones, I think, are simple yet extremely important ways of limiting virus infection. And these include things we've heard a lot about: cleaning your hands regularly, proper sneeze and cough etiquette, trying to avoid touching your face, your nose or your mouth, practicing appropriate social distancing, continuing to try and live a healthy lifestyle, including healthy eating, exercise as you're able, and good sleep, at least if the dexamethasone lets you do so. Some advice, however, will differ across states and institutions, and of course this will be driven by local epidemiology in an attempt to deliver the safest possible care for you. Some of this advice at the community level we can see differs. For example, differences in restrictions on public gathering, differences between the states in terms of when schools may reopen. This will also apply to advice in relation to treatment of multiple myeloma. For example, many institutions have deferred autologous stem cell transplantation for the initial treatment of young patients with myeloma. But at some stage in the next 6 months or year, this practice of early transplant will return. But this is likely to vary across institutions and states as doctors look at their local epidemiology and act in concert with their hospital executives and indeed state health departments to plan the restoration of normal services. Things such as regular attendance at the hospital clinics for things like supportive care, Zometa and Pamidronate for bone health, intravenous immunoglobulin replacement for those who require it, indeed even just attendance at the clinics, again will vary, and different hospitals will have different approaches based on their local epidemiology. So where can you get the best advice for what's appropriate for you? I think in terms of the overall approach, still the federal government and state health departments are the best places for authoritative advice. They have good collaboration with their healthcare advisors, and the websites, both federally and state, provide excellent information. In terms of management of your myeloma, the best place for advice remains your treating doctor or team, your myeloma nurse, or the institution or clinic where you're receiving your therapy. Advice that applies in one area of the country may not be appropriate in another. I hope these comments have been helpful to you. Stay safe. Thank you.